You guys there? Can you hear me?
Yep, ready to go, Joe.
Yep.
Okay. When we get ready to go, I'm going to go ahead and begin. Let me get my, just lost it here. 1 second. Okay, we'll go ahead and start the meeting. The Human Services and Community Safety meeting for April 23rd here at 12:03 p.m. Okay, I'm Councilmember Navarro. I'm going to call the Human Service and Community Safety Committee meeting to order and reading the following statements. Due to concerns over the exposure of the coronavirus, the city has implemented measures to protect our community, including the closing of the council chamber and limiting public attendance to electronic means only. Members of the public may attend the meeting virtually through Cisco's WebEx event or view the meeting recording by visiting www.tempe.gov/clerk for more information. Okay, we're going to go ahead and call to order. Roll call. I'm going to go ahead and I would like to call the meeting of April 23rd, 2001, Human Services and Community Safety Committee meeting. Okay, we're going to go ahead and review the minutes. Councilmember Doreen Garland.
Hi, I'd like to make a motion to approve the meeting minutes from our last meeting on March 26th.
Okay, there's a motion, and we'll go ahead and any questions? If not,
no
I'm sorry?
Nope, no questions.
Okay, then we'll go ahead and move the meeting for approval. And Tim, is that about it? I mean, do we have anyone to second it?
No, sir, since it's only the two of you.
Yeah, that's about it. So we'll go ahead and approve those meeting minutes. Councilmember Garland, let's see. I think you're up next. Let's see.
Okay.
So as Councilmember Garland states, the next items on agenda is
Yep,
the public
yep.
comments.
Yeah, do we have any comment cards, Tim?
Councilmember, no, we do not.
We are good.
Right.
Okay.
All right.
If we don't, we're not going to go ahead and read the official language. I think we can just move on. Okay, let's go into comment cards since we have none amended. Next items on the agenda is the committee session items, new items for consideration. Committee session items, current items, and updates. Presentation on Tempe Police Department 1-year Narcan program. We're going to go ahead and we're going to bring in Sergeant Rob Ferriero and Officer Dave Hansen. Are they there?
Yes. Can you hear me, Councilmember Navarro?
Yep, Dave Hansen's here too.
Great.
Thanks, guys. Go ahead.
Great. Thank you very much. So Councilmember Navarro and Councilmember Garland, thank you for having us. We're going to give a brief overview of our Narcan project that we have been running for operationally for just over a year now. So just back real quick. So my name is Rob Ferraro. I am a sergeant with the Tempe Police Department, and I currently, for one of the other hats I wear in our department, is I am the project manager of our opioid program, and I have with me Dave Hansen, who's an officer with Tempe PD, also who is a program coordinator. And so just briefly, my role in this program is to basically liaison with our partners. So the federal government being SAMHSA, the Substance Abuse and Mental Health Service Administration, and then our community partner, Impact Suicide Prevention Center, who you'll hear about shortly in the presentation, and then also with ASU, who is our evaluator in this project. And so that's kind of my main role. And then Officer Hansen really just maintains the program and makes sure all the training is done, the logistics, ordering Narcan, following up and doing all of the boots on the ground on the floor. So a lot of this is a credit to him and the amazing work that he is doing. So we have a few slides for you that we're gonna jump into, and then at the end, I think what is most impactful in this entire presentation is about a 4-minute video of a recent save, all taken from body-worn cameras. Just a tremendous video that I think is just will really hit home what we're talking about now. So let's see here. Let me make sure I can. Okay, Dave Hansen
Sure.
is going to take this slide.
So these are just the stats from Arizona Department of Health Services for a 5-year period from 2017 to last year in July, where they had about 6,500 deaths due to an opioid overdose. And then they quantify about 47,000 suspected overdoses, and they get those from reporting from agencies, fire departments around it, and it relates to how much Narcan has been used. Obviously over the years, those death rates have been increasing as the opioid crisis has kind of gotten a bit crazy. Our county specifically, we see about 50% of those overdoses, mainly because we're the largest county in the state of Arizona. We did have 544 overdoses during that period, resulting in 76 deaths. So that means a fire crew was out there or cops were out there for these people dying. Really, the highlight of this slide is if you break it down to the rates per thousand, Tempe has a higher rate than the national average of 13%-ish.
Great, thanks, Dave. And so, really, from the very beginning, this was going to be a very unique approach. And ultimately, what happened was we were approached by Impact Suicide Prevention Center, who's located in Tempe, and in an effort to, when this grant had come out from SAMHSA, it was a $2 million grant over the course of 4 years to ultimately to deploy Narcan into the community via PD. And so while Tempe PD might have been a little bit slow in rolling out Narcan over the past several years, we wanted to take a very innovative approach, and we just didn't want to have cops, carry Narcan, use it, and then ultimately the person goes to the hospital and then they leave, and nothing kind of ever happens after that. So what we wanted to do was really, we know that after Narcan uses, when someone is in the hospital, that there's a moment of opportunity to really engage that individual and trying to build rapport and connect them to services. So that's what this grant kind of entailed. And so, as I mentioned, $2 million over 4 years. It was going to bring one sworn position, and that is Dave Hansen, to provide the logistical support. And then we had 2 full-time positions for Impact. They're going to be our crisis outreach peer support, that we're going to be contacting these individuals and trying to get them engaged in services right after the initial hit of Narcan. Our partnership was going to be also with Arizona State University, so they're also in this grant, and they evaluate usage, they evaluate body-worn camera footage, and then ultimately reporting back to the federal government on our outcomes, which are going to be seen here very shortly. So let's go to the next slide, and that's up for Dave. Dave, you might be muted. Dave, you on?
So, sorry, I'm just getting a little feedback. So the program's pretty easy. The whole goal is to make it super simple. An officer or a firefighter administers Narcan in the field. Our officers call this 24/7 hotline. They give them some pretty quick information, who the person is, where they are, what hospital they're going to, and maybe if they had some safety considerations. The hotline then will call one of us that we're on standby, along with one of our impact negotiators, or one of our impact navigators. And then we, if it's the middle of the night, we'll get up, we'll go to the hospital. and we'll make contact with this person or their family, explain the program, offer some support, give them some take-home Narcan, and really just open up the book to say, here's every resource that is available to you. From we can get you to meetings, we can get you into 90-day programs. There's a whole ton of resources available. We just need you, if you're ready, we're ready. And then the officer afterwards fills out a super quick report. I get that stuff, and then once we're done with the hospital, we document that and kind of do the follow-up with all the involved partners.
Thanks, Dave. And so this is kind of I mentioned it prior to the previous slide, but that window of insight, and this is really the kind of the bread and butter of this grant and this program, and where we're going to see the desired outcomes. And it is like Dave said, it's within the officers calling that hotline before they're clearing the call, and they're answering very quick questions. It's got to be super quick, otherwise the cop probably won't do it. So we make it super quick for them to do it, and then a peer is coming out to where they are, to that hospital, within an hour. And it's usually within about a half hour where the peer is arriving, contacting them in the hospital, and trying to build that rapport, trying to engage them in those resources that are available that Dave kind of mentioned, leveraging a lot of the community behavioral health partnerships and resources that are out there, and trying to get them in. And then the biggest piece is that it needed to be a peer. It needed to be someone with lived experiences that was going to be able to make that connection with an individual that might have it might have been a suicide attempt, it might have been drug use, whatever it might have been accidental, and so it's someone who is a peer that can build that rapport, because we know that works, and that's best practice. And so we're also giving out community Narcan. Impact carries community Narcan with them. It gives them to the individual, so they leave the hospital with Narcan. And also, if family members are there, they're contacting family, also doing the same thing and just engaging support for the family, giving them Narcan as well, and then ultimately getting a release from them so that they can then contact them. And then the next day, an impact peer is contacting them again, where they might be, and trying to again engage them and follow up on those resources and that initial contact that they had in the hospital. And so it's a very wrapped around type service, and it has to be immediately after that use in the hospital, which was what we have found to be a success. So, and Dave on the next slide is going to talk about those successes.
So out of the last 14 months, we've used Narcan 117 times. We originally thought we were only going to use it about 30 times. That's kind of the first number we built into the grant, and so we kind of blew that away, and we had to adjust some things there. We have 110 saves. Actually, we just had one the other night inside the jail on somebody who was in custody inside the jail who ate a bunch of pills before he was arrested. And that's actually about the third or fourth time we've had people who have ingested a bunch of pills before they get arrested. They're in custody, they're in our handcuffs, they're dealing with us, and they go into their overdose and start to die. And so we have to very quickly react to that and provide services. Got about half of that, 72 people have been enrolled in some kind of supportive service. That includes the person who overdosed. We also reach out to family members and friends, because there's a lot of friends and loved ones who have substance abuse issues. And so if they speak up and they're interested in the program, we get some resources under them. Our community Narcan, we've given out about 150 to people. We've had 6 people in our city who have repeatedly overdosed. 2 of those people actually finally got into some services after really, I talked to the guy in the hospital and asked him either to get services or to find another city to start, kind of dying in, because our fire crews started to know who he was. Our cops recognize him. And, it was time for him to make some change. So he actually enrolled in one of the 90-day programs, which was great. And then our very first one, you know, when we first started this program, we all assumed it was just going to be homeless people in Tempe Town Lake, because, you know, that's kind of the stigma around it and kind of the what people think. But our first guy was an 18-year-old, 19-year-old kid who basically was a suicide attempt. He was, you know, wherever he was in his life, he put out on Twitter he wanted to end it, and he took a bunch of pills. So a bunch of his friends called us, and we went to his house down in South Tempe. And that was our first Narcan save. And he was the opposite of kind of what we assumed was going to happen. You know, he was a kid, he's got a family, he's got resources, he's got you know, he's got a support system around him. You know, he lives in a nice house. So it was pretty interesting. And for the cops that were there, just to see the first use actually work was pretty impressive too. It's always good. And then, you know, randomly we had somebody who received one of our community Narcan kits at the hospital, who ended up using that kit on a friend later on to help that friend who was going through an overdose. So that's kind of a nice, you know, circle to fill out, to know that really something helped out with that kid that overdosed.
Thanks, Dave. And so I'm gonna next up share a video, which I think again is really most impactful. And so just bear with me for one moment. But so it's about 4 minutes, and there's going to be audio in the beginning. It mutes for about, I'd say about 40 seconds or so, and then audio comes back on. So if you don't hear anything, that's going on there. So give me one moment.
Just started like, okay, both of them, please, both of them, please, both of them, please. Okay. Get your Narcan. Back. Can you get the dog? Hey, can you get the dog? Honey, get over here. Now, get over here. Over there, please.
For plus 23, we're both administering 2 doses of Narcan. It is going to be 2 meals down.
2 officers are assessing him right now.
Hey, bud, wake up for me. Come on. Wake up for me, bud. Okay, I don't need. We don't need to talk to them. You're good. Wake up for me, bud. You only have 2, right? No, I got 2. Okay. You're good, bud. Come on. Come on. Ma'am, hey, you're okay. The fire department's gonna come in, so can you put him away? Come on, bud.
23, we're both starting to see drugs.
Wake up, bud. Hey. Come on. Come on, buddy. Come on. The fire department's gonna come in, so if you can put him away, will you? What are their names? Okay. Okay.
So these officers are still working on the people, and they're still having to deal with the friends that are upset and trying to figure out what's happening with the rest of the scene.
So Rob, are the officers both doing CPR right now? I can't.
Yes.
Okay, got it.
Yep. And now there's going to be a third individual that goes down.
Okay, what's going on? Okay. Where'd the fire guy hold into?
I have two other people in there who are sick and they're helping her and she started doing this.
Okay, let's get her laid out.
Oh my God.
Here, step back to me. All the fire guys inside?
A few of them are, yeah.
Rob, are these nasal or IM or Narcan you guys are giving?
Started dropping.
What was that?
Are these nasal or IM?
Nasal.
Narcan? Okay, thank you.
Yep.
All right. Perfect. This is the guys who are going to work.
I don't know. I need you to check for me. I don't know.
Can you repeat it?
Oh my God. This is not happening right now.
Let's go ahead and step back. Okay.
Oh my God. It's not happening right now.
Hey.
So you can see it was extremely chaotic event. There were 3 people that ultimately that evening received Narcan. Councilmember Navarro, just so we're carrying the 4 milligram Narcan, and I think it was Dave. Correct me if I'm wrong, but I think in total it was over 6 doses of Narcan were used that evening. So.
Yeah, everybody got 2 from us, and then the fire guys had to provide some more on the 2 guys inside.
Right. So was it a fentanyl type of overdose? Did you guys know by chance?
That specific one, yes. And we're finding that many of the much of it is fentanyl. That's other drugs being cut with fentanyl, and not the individuals not knowing that, and so ultimately finding out when the person passes out and then stops breathing ultimately. So yeah, so that's it. It was we felt like the showing a video was going to be much more impactful also, but this is the relationship that we have with Tempe Fire has been fantastic. The relationship with the hospitals, everything coming together. I can't. This is unfortunately we're doing this because of the opioid crisis, but it's just the program's success has been beyond our wildest dreams and what we had planned for. And the real hope, the real outcomes is getting individuals into resources, into treatment programs. So ultimately we can mitigate the use of opioids in our community, and hopefully we start to see some outcomes and reduce usage. So thank you very much for your time. If either of you have any questions, please.
Yeah, Rob, I have a few, but Doreen, why don't you go ahead?
Rob, I just have to say that video, it was very impactful. It's given me chills. It's in one thing to read about the statistics and read about what you're doing, but it's a completely different thing to see how it's being used. I am also just amazed at the amount that you thought that you guys were going to be using. That's the number 30, and that you've actually used it 117 times. That's just shocking to me. One of the early statistics that Dave Hansen put down is on one of the slides, it said that our rate, I couldn't remember if it was the rate of use is 22.5 and the national average is 13.3. Was that Narcan that was given to people?
That was death. That was death rates, and so. Okay. That could be attributed to not having enough Narcan in the community. There could be several attributes to that, but it was Yeah, that was our death rate compared to the national average.
Okay, and I also looked on the city of Tempe has a map that kind of splits up the city and shows you where those Narcan uses were, and it was amazing to see the locations in the city where those are being used the most. So that was really helpful. So what do you think we could do as a community? So I took a Narcan training. The Tempe Coalition was offering it. I took a Narcan.
She timing out on you guys?
Yes, sir.
Yes.
Give her a minute here, see
Yeah.
what happens. She's spinning. Doreen, we can't hear you if you can hear us.
I could partially answer that if you
Go for it.
I think so. I think I think ultimately the question is what can we do to further increase knowledge, and so that's one of the next things that we're working on, and it's part of this grant. Is basically a public service announcement type piece, and that's something we wrote for in the grant that we were going to be doing for the community. And so that is in the very beginning stages. We hope to get that rolled out very soon, but we were in our planning stages of doing about a 30-minute type video, but then breaking it up into like 1 to 2 minute clips that we could use for social media, and so that would be with our partnership through Impact in doing that. But really just getting out the knowledge of the dangers of opioids, because I think most people don't realize how much opioids are in their homes right now in terms of pills, medications, expired things like that. And so just that those dangers that exist. And so giving the knowledge and letting folks know, hey, this is obviously we're dealing with a crisis with opioids, but then also the big piece is just putting out as much Narcan as possible in the community. We're just trying to dump it, and essentially, and so when we go out and make those contacts with the family members and everybody else, it's just we need to get more Narcan in the hands of folks, and so that's a big piece of it as well.
Yeah, Rob, I absolutely. I have to tell you, man, this is probably opened my eyes a little bit, because for the last 6 years I've been kind of doing this stuff. This is one of the things that I always get frustrated with, is the fact that we can give Narcan, but we don't have the follow-up piece to it, which is this is absolutely perfect, because that piece of being at the hospital to get with the person to start getting them help, that is the critical moment. That is absolutely the critical moment, because they are now recognizing where they're at, and where they're at in their life potentially. And the second thing is, even if they don't take the help at that point in time, they know that that help is there, or where to get that help, or the family members know where to get that help. So that is the one critical piece where I'm just absolutely amazed that we're doing. I think this is highly incredible in terms of the fact that these positions got grant funded. So let me go back. So we have an officer who gets the call from any 911 call. Hey, we got opioids, they're going to the hospital. Is this correct?
So initially, it's 911 call comes out, and if it's opioid overdose, cops go. So that was the biggest piece first. So every single cop, patrol cop, any uniformed officer in Tempe is carrying Narcan on their person, on their vest. And so they go out, they utilize it, or if we're out on a scene and fire has used it, we've also trained fire in a sense to, hey, just let us know you used it, and we'll take care of everything, because we didn't want to make fire have to do anything that they didn't, create more burdens for them. So that cop then calls that hotline that's 24/7 through Impact. They then contact the navigator who's on call 24/7 or working, and then also if the cop is needed as well as for that type of co-responder model, but they're there within 30 minutes. So we have a group of cops that are able to assist that peer navigator in the hospital if needed. And so so that's a within 30 minutes that's getting done, and that person's being contacted.
So PD, fire, anyone has access to it. It's Care 7. They can have access to this person.
So specifically with this person, it's just through our grant, So
No, I'm sorry, I apologize. It on any call, PD going on a call, fire going on a call, it's Overdose, they each group and maybe Care 7 have access to the person, the phone number to call this person to get the ball rolling to go to the hospital. Is that correct? Or is it just the PD?
It's right. So it's just the PD. We wanted to streamline it as much as possible. So if the cops use it, whoever uses it, that cop knows that they have to call that hotline.
Got it.
If the cops are on scene and fires used it, that cop is going to call that hotline, because we wanted to make it as streamlined as possible with very few decision trees, because then things get complicated and they don't do it. And we haven't had an instance, I don't think we've had an instance where a cop hasn't called when fires used it, if the cops are on scene.
Okay, yeah, that's probably the piece and not to where you're at in your point of your program, but that's the piece where I'm just want things to get streamlined is PD or fire, overdose, and they have access to this person to get the ball rolling to meet the patient at the hospital. A Care 7 type of crisis, where they have an individual that is wanting to get help at the moment, being able to have access to, and maybe with the Care 7 point of view, they already have the resources. I would hope the similar resources to, hey, here's where you need to get help at. Here's where you need to go and find help. But I think the piece where you guys go, and let me just back up. I'm just because I'm trying to understand the dispatch on this. Usually, are these calls coming in medical dispatch, or are they coming in no matter what, Narcan dispatch or overdose dispatch? You guys are also going on those calls. How's this working?
Yeah, so the call is usually, it's coming in through 911, and generally what's happening is we're responding. PD is co-responding with fire on these calls, and so yeah, it's coming in from and generally for opioid. Other types of overdoses, whether it's someone took Tylenol or Adderall or something that they are overdosing on. We sometimes respond to those, but generally not, because there's not much we can do, PD can do in that instance.
Okay, so I see the coordination as a possible overdose, opioids. You guys are going to get that along with fire, and got it. If I'm correct. Dorena, you're back in.
I am, thank you, but I don't have any more questions. Rob, that was a great presentation, and Dave, thank you so very much.
You're very welcome.
Guys. So yeah, I'm excited. What do you guys need? I know that personally, I want to utilize this information. I think that all council members, have an opportunity to utilize it. We do coffee talks. I'm going to do a coffee talk at the end of this month or end of May. And this would absolutely be something I would like to share with the public for sure on that. But before we hit that, what do we need, or is this a presentation we want to take to the council? For sure, I want to present it. Is this a work study that we can do this at? Tim, what do we have?
I'm sorry, Councilmember. I thought you were asking Rob. I mean, you can make the recommendation from this council committee in a variety of ways. We can talk to staff offline. I know Rob said that this program has more things that it's trying to achieve right now, but I can talk to Rob and Assistant Chief Pooley and see what they think.
Yeah, I think for Rob, really for you, it's when you're ready to possibly present this. But I love the fact that ASU is involved and we're getting data through them. I just love how this thing's rolled out. I've been at NLC for so many years now, and the things that they're trying back east to get things going and stuff. I hope they have something similar to this, because how the coordination of this is working is absolutely perfect, man. I can't say enough. So
thank you. And just real quick, I think it's also just important to just know our federal SAMHSA is very much impressed with how we how we're handling this too. And I think even like piggybacking off of the public safety task force, there's a model here that we can potentially start to look to replicate in terms of other types of calls, whether it's a domestic violence call or a juvenile type call, where we know that cops and firefighters are the ones there first, making that contact when the person's in crisis. But let's talk about handing things off and giving that wraparound type service. So this is something that can be replicated. And so, I mean, we have the data, we have ASU evaluating. It could be very interesting moving into the future of how we handle these other types of calls based upon replicating off of this type of model. So something to kind of think of.
Yeah, no, I absolutely, man. And that's the whole thing is when we go out on these calls, it's timing. It is you absolutely have the perfect time to present the resources to get the person help. That's why I'm just, in the past, I'm like, it's so frustrating because that was the essence of everything. We have someone in mental health crisis and we're going on them and we're sitting there waiting for CBI to come in 35 to 45 minutes. And that person just says, I'm done, I'm going, see ya. There's that missed opportunity. That's why I'm saying this has so many, just like you said, Rob, that this has got so much value in other areas going forward, which I just love this thing, man. This is awesome. So perfect.
Joe, this is Dorian. I agree. I think it would be great if maybe Tim could work with Rob and talk to staff and maybe do a work study presentation on this, because I do think this is great information. I'd love to be able to share this with the council members.
Yeah, absolutely. We have to share this. So yeah, let's work on that. Tim, let's work with Rob on that and we'll figure that out. And we'll go forward from there.
Sounds good.
All right. We'll go ahead and move on. Rob, thanks, guys. Dave, thank you. This is great stuff.
Welcome. Thank you.
Okay, going forward, let me get my script. We have, let's go. We're going to welcome Human Services Director Naomi Farrell and Housing Manager Lavani Laney for their presentation. Are they on?
Good afternoon, Councilmember Navarro and Garland. I'm Naomi Farrell and Lavani Laney presenting this afternoon on Hometown for All. The presentation this afternoon will introduce the Hometown for All initiative. We'll clarify the funding and eligible uses of the funds, explain the Tempe Coalition for Affordable Housing, which we call the affiliate, and the City of Tempe and affiliate agreement to support affordable housing. We'll go over the details on that agreement as well. Tempe Mayor and Council are dedicated to maintaining affordable housing in our city to create a community for everyone. This was formalized in 2017 when Council agreed Tempe should be maintaining a balanced housing inventory ratio and included specific targets as part of a performance measure. The approval of the Hometown for All initiative by Mayor and Council in January of this year accelerates housing affordability with an identified sustainable revenue source. This will help to create the next generation of affordable and workforce housing opportunities in the city of Tempe by ensuring a variety of housing types are available for anyone who wants to live in our city. In addition, this may also amplify the city's efforts to buy and build its own affordable and workforce housing options. The revenue source is important because funding affordable housing in Arizona requires a unique approach. The typical methods employed in other states like tax increment financing, real estate transfer taxes, and inclusionary zoning are all not permissible in Arizona. Now that Council have committed the 50% of building permit fees per new development project will be allocated to the Hometown for All initiative. As an example, during fiscal year 1920, the city received approximately $5 million in revenue from building permit fees. If this policy had been in place, that would have resulted in approximately $2.5 million for housing. At this time, I'm going to turn it over to Housing Manager Lavani Laney, and he'll walk us through much of the details of the Hometown for All initiative.
So good afternoon. Starting in with funding, the funding structure, part of a dedicated funding stream, which this does date back to the Affordable Housing Strategy document Mayor and Council approved in July of 2019, and have been working towards implementing those strategies moving forward. A dedicated funding stream is and can be one of the largest barriers to developing affordable and workforce housing. So Mayor and Council approved equivalent of 50% of building permit fees would be allocated on an annual basis to the Tempe Coalition for Affordable Housing, Inc., or the affiliate. That is the affiliate nonprofit of the Public Housing Authority. And we'll get into a little bit more detail on that a little later in the presentation. There was also a suggested formula for voluntary donations. There is a percentage suggestion for private residence development, and there is a suggested donation for commercial development based on the size of those projects that would go towards supporting and continuing to develop and preserve affordable and workforce housing. Now, there were some guide rails put on these funding uses and attempted to make sure that the funds are utilized for council-approved purposes and the appropriate restrictions. So there are overall 5 broad buckets that the funding will be divided into. The first is the acquisition of land for assemblage. So it's, and on your slide, it says either improved or unimproved land. Improved properties are properties that have a structure on them currently. So it may be a house, it may be a duplex, it could be a garage, but it is ground that has its structure already in place. Unimproved properties are defined as vacant lots where really you just get dirt and tumbleweeds on those pieces of property. The overall logic in the acquisition of land for the assemblage is to be able to acquire the property, to build out, to provide opportunities for the development of affordable or workforce housing projects. One of the largest pieces to any pro forma when you're looking at developing these housing types is the overall cost of land. So by taking the cost of land acquisition out of the equation, it does make it more attractive and easier in order for developers to develop this type of project. There is money set aside for the acquisition of permanently affordable workforce rental units. As we do with the 0 to 80% area median income as part of the Community Development Block Grant and federal funding for low and extremely low income households, we are working towards building a base of workforce rental units for households at 81 to 120% of the area median income. These properties could be single family, attached, detached, condos, townhouses, any of those housing types that would then be held in perpetuity as income-based rentals for households within this income range. And when we do rent these properties out, the rent is based at 30% of the income. We do follow HUD's, the HUD's guidelines of 30% of your income should be allocated towards rent. So moving on, there is funding, a funding pot that is dedicated to incentivizing development. That would be put out as a notice of funding availability, or NOFA. It creates the availability for developers, either private or nonprofit developers, to apply for some funding to help buy down the cost of their project. That funding, as was approved by council with the overall agreement between the city and the affiliate, that notice of funding availability would be issued at the point that $1 million had collected in that account. That way, not saying that the $1 million would all go towards one developer, but I mean, in theory, it could go to 2 developers at 500,000, 4 developers at 250, but it creates the availability of a significant funding source to help bring down the cost of that development. The last is the creation of a down payment assistance program. We do understand and support the importance of home ownership for households where that is more their goal than being long-term renters. And with the workforce income levels of 81 to 120% of the area median income, those are over the HUD stated guidelines for the current community assistance mortgage program down payment assistance. However, we have structured this program as a mirror to that. So there would be up to $35,000 in down payment assistance that could be applied for households in this income bracket. They would have to demonstrate income eligibility. From there, this is a loan, or it could be a long-term grant. It is 0 interest. The way this is structured is caveats and covenants are placed on the property that the $35,000 would need to be repaid to the program in the event that they refinance their loan for anything other than a reduction in the interest rate, if the house is sold, or if title is transferred to a non-income eligible family. What this does on the long term is as folks live in their units, families either outgrow it or they decide to sell that unit, then the $35,000 or up to $35,000 in down payment assistance is reverted back to the program so that it's put back in circulation to further assist other future families. They're creating long-term financial sustainability for that piece of the project. Overall, with the equivalent of the building permit fees, it's anticipated that somewhere between $2 and $4 million a year would be coming in for these specific hometown for all purposes, and that is, that is based on, will be based on budget and any voluntary donations that would be received in moving forward. As part of the approved agreement, the funding is allocated, so we have provided an example of the approved allocation breakdown. So for theoretical project 1, part of the $94,005 is put in for the acquisition of improved properties. $94 is put in for unimproved, permanently affordable rental, which is workforce, held for notice, ownership opportunities, and there is a cap of 10% of the funding allocation could be utilized towards the administrative fees of operating these programs if it's needed. If the administrative fees are not needed, it would be reverted back into the programs themselves. So there are multiple examples depending on the various amounts, breaking out to, on this particular example, $208,800 per activity, $116,000 available for administrative fees moving forward, should they be needed, for total theoretical donations of $1.1 million that would be available to support these activities with the affiliate. Now, the affiliate, or the Tempe Coalition for Affordable Housing, Inc., this is a 501c3 nonprofit, and it is a specifically structured nonprofit as the affiliate nonprofit of the City of Tempe Public Housing Authority. This is a specifically designed nonprofit. It is limited in what its core functions are, which are to support housing, affordable, and workforce. It does maintain the covenants with these properties, and the agreements with the city are in such that any properties that are acquired and transferred or managed by the affiliate cannot be sold without the consent of council. They cannot be transferred to any other use than the assigned use, and covenants are appropriately placed on the properties. This has been memorialized in a contract between the City of Tempe and the affiliate, which does outline the limits to the use of funds to the approved purposes, and it sets reporting requirements. As the agreement is currently structured, there will be quarterly presentations to the City of Tempe Housing Authority Governing Board on the activity of the Hometown for All initiative, of any outcomes and any outcomes or accomplishments that have been, have occurred in that quarterly basis. It also outlines that on an annual basis, there will be a report generated for the Housing Authority Governing Board and the City of Tempe City Council to review the accomplishments from the prior year, the funding allocations or recommendations for any future years. And that will be an iterative process that is reviewed on an annual basis. This was designed so that it follows the timeline of the City of Tempe Community Development Block Grant, Home Investment Partnership Program, and Emergency Solutions Grant, and Tempe Housing Authority Consolidated Plan. Therefore, all housing activities, whether it's federal funds or City of Tempe general funds or private donations through the affiliate, are geared towards the same 5-year cycle and all working towards accomplishing the same overall goals that are identified during the needs assessment that is conducted on an annual basis, or on every 5 years as we develop that 5-year consolidated plan. So that's the overall of Hometown for All, the funding structure, the affiliate, and what the approved allocation and uses of the funding is. And we will stop there for any questions or clarifications anyone may have.
Levon, this is outstanding. I'm going to go ahead and Dorian, why don't you go first? Is there any questions you'd like to? I have one. See if Dorian's on. While we are waiting, the question on the funding that the City of Tempe has is about $1 million earmarked. How long have we been roughly collecting that money in that fund?
So that there is that fund. Excuse me. Let me start over. There is at this point roughly $1 million that has been earmarked and allocated. That has only started collecting since January, when Council approved the initiative, and then some. There were other funding donations that came in as part of other agreements that were generated by the city. So this does not, the funding that is in there now is roughly $600,000 that does not come from the general fund. As part of next year's overall city budget, there is funding proposed and subject to future approval as part of the budget process that would put additional funding in here that would then increase this funding balance moving forward.
Perfect. So the things that so that I'm correct. So when we say, hey, affordable housing, we want to make a donation towards affordable housing, that's the fund that it's going into. Correct?
Yes, sir.
Okay. And so we're not.
I'm sorry.
No, go first.
And the way that, the way that the agreement was structured, and I did back the presentation up a little bit, is so as those private donations, or, as folks are donating because they want to, or, developers want to push in funding, it is the way this agreement was structured is that those funds will come in and they will be applied to the same spread as what the general fund is, thereby proportionately increasing each of these pots of funding to be able to compound the impact between the city and then the private donations.
Got it. Perfect. All right. Thank you so much.
So I have a question.
Yes, go.
I have a question. Hi, sorry about that, guys. I'm having a little bit of technical issues here. Levon, have you seen the ability that with the money that's coming in, can you guys see a future where we are really going to be able to start tackling the affordable housing crisis, knowing that more affordable housing is needed in the future? Do you really feel like the overdoing is taking really good that goal?
Councilmember Garland, of course, I manage housing, so my response is going to be from a housing perspective strictly. But I do resources that are applied in the ability to incentivize and assist with the development of affordable housing definitely puts us in a position to where it is accelerating that goal. One of the funding initiatives that council has already approved is funding approximately $1.2 million in phase 1 environmental, cultural resource, and mitigation in order to clear 5 sites for the development of affordable and workforce housing. That $1.2 million, while it's, I mean, in and of itself, that is a lot of money. However, these 5 sites, as the projects are currently proposed, are creating 390 units of affordable and workforce housing, where, you know, we, the city, are putting in, you know, roughly $1.2 million, depending on exactly, that's our maximum budget for that project. However, we, the city, are putting in approximately $1.2 million towards the clearance of these sites, but then we've partnered with developers to come in and create these 390 affordable housing units, and just math off the top of my head, but you know, that comes into an investment of roughly $5,000 per unit, plus or minus, for the creation of that 390 units. So it is definitely pushing that development forward at a much faster pace. I was actually having a conversation earlier today with one of the developers on those projects, who was extremely happy with the fact that we were clearing that site and being able to go back and look at their pro forma, because with us being able to clear that site and not push that cost onto them, we are going to be able to reduce the maximum area median income so that this is truly affordable, truly workforce units at that lower and available to those lower income bands. So it definitely makes a difference. Obviously, with construction or with housing, you know, it takes a little while to really get traction and to get projects moving and coming online. But I would absolutely argue that we have made significant strides towards getting them online, getting them moving, and starting to put units in production within the next few years.
Yeah, it looks like that we're, you know, really taking the opportunities that we have here and being really creative to move the needle. And I do think, you know, getting those properties mitigated before, you know, we start building. I just think that was so forward thinking, such a great way to kind of move the needle for us. I just want to tell you, thank you so much. I think you guys do an incredible job.
Thank you.
Yeah, Naomi, yeah, this is absolutely great, guys. I mean, you guys are just staying on top of this stuff and looking and putting us in a great position for the city. Now, obviously, this is a concern for our community, and this information is so valuable. And yes, I would like to also, I know we had the last coffee talk, we shared this information, and I thought that was absolutely outstanding, and definitely want to revisit it again to share that information again. And not only for that, but also for the council. So this is great. Is there any other questions? Okay.
I don't have any other questions.
Okay. Seeing none, we're going to go ahead and move on. We have the let's see, the presentation for the next Human Service and Council Committee meeting will be the presentation on the downtown safety study, presentation on healthy and giving, and the presentation on opioid epidemic educational efforts, which would be great tied in with the conversation today. So those three items will be presented on May 28th. Councilmember Garland, is there anything that you would like to add?
No, I think those are great topics, and I think it's going to be another really great meeting. Thank you.
Okay. I think there's a possibility we might add some information on our efforts as a city to support residents as they're being as the eviction moratorium is nearing the end of June 30th. So maybe we can have a presentation on that, or some information on that, or building something on that as we come to the June 30th moratorium.
Yeah,
so
I think it's a great idea.
Yeah, have some evictions. Okay, cool.
Great idea.
With that said, yep. If any more announcements, if no more announcements, our next council or our next committee meeting is going to be May 28th at 12 p.m. And if that is it, we are adjourned. I appreciate everybody. Thank you so much for your time in the presentations. These were great. Thank you.
Thank you, everybody. Thanks, Joel.
All right, guys. We'll see you. Thank you.
Bye.